Can adults get RSV? Symptoms, diagnosis, vaccines. RSV respiratory syncytial virus is usually more a nuisance than a threat, but for people in high risk groups, including older adults, it can lead to potentially life threatening complications. If you are like most people, you have almost definitely been infected with RSV at least once. In fact, it's likely you have had RSV multiple times. This seasonal virus is so widespread that almost all of us have had an RSV infection by the time we turn two, according to the National Foundation for Infectious Diseases. Most of the times, an RSV infection is merely uncomfortable, but in some cases, it can be life threatening. It is a particular danger to babies younger than 6 months, for whom an infection in the lungs and breathing passages can lead to serious illness, hospitalization, and even death. Other groups at high risk of severe disease from RSV include people who are immunocompromised and adults age 65 and up. In fact, the NFID has called RSV in older adults a hidden annual epidemic. Each year, an estimated 60,000 to 160,000 older adults in the United States are hospitalized due to complications from RSV, and 6,000 to 10,000 die from this virus, according to the Centers for Disease Control and Prevention (CDC). Common questions and answers. Can adults get RSV? Yes, adults can get RSV. In fact, most adults have been infected with RSV at least once in their lives. What are the symptoms of RSV in adults? How do adults get RSV? Who is most at risk from RSV as an adult? How is RSV in adults diagnosed and treated? A seasonal shift and increase in RSV cases. Peak season for RSV infection is in the United States is fall, winter, and spring, but some doctors have been seeing infections in warmer months as well. During the height of the COVID-19 pandemic in 2020 and 2021, health agencies reported a steep drop in cases of RSV and flu in the United States and around the world, according to research published September 2021 in Pandemic. 10 steps adults should take to prevent RSV. Is it a cold or RSV? How to tell the difference? Are you at high risk for severe RSV? The combined threat of RSV, COVID-19, and flu has led public health experts to coin a new term, triple demic. Symptoms of RSV in adults. For most healthy adults who get RSV, the virus causes symptoms resembling those of a cold or the flu: runny nose, nasal and congestion, sore throat, and cough. A breaking or wheezing cough, however, may be reason to worry about RSV. It may signal the infection is getting worse and has spread to the lower respiratory tract, causing bronchitis and inflammation of the small airways in the lung, or pneumonia, an infection of the. How do adults get RSV? Like other respiratory infections, RSV is highly contagious and spreads via sneezing, coughing, even kissing. The airborne virus can enter the body through the eyes, nose, or mouth, says the Cleveland Clinics. The virus can also spread to people who touch contaminated surfaces or objects and then touch their face. RSV is usually contagious for 3 to 8 days, but some infected infants and people with weakened immune systems can continue to spread the virus for as long as 4 weeks, according to the CDC. Diagnosis. A diagnosis of respiratory syncytial virus or RSV might be based on a physical exams and the time of the year you have the symptoms. The doctor listens to your lungs to check for wheezing and abnormal sounds. Other tests aren't usually needed, but your doctor may suggest blood test or test a swab of the inside of your mouth or nose to look for signs of infections. You may need a chest x-ray to look at the lungs. Sometimes a doctor may use a device to measure oxygen levels in your body through your skin. Your doctor may suspect respiratory syncytial virus based on the findings of a physical exam and the time of year the symptoms occur. During the exam, the doctor will listen to the lungs with a stethoscope to check for wheezing or other abnormal sounds. Laboratory and imaging tests aren't usually needed, however, they can help diagnose respiratory syncytial virus (RSV) complications or rule out other conditions that may cause similar symptoms. Test may include blood test to check white cells count or to look for viruses, bacteria, and other germs. Chest X-ray to check for lung inflammation, swab of secretions from inside the mouth or nose to check for signs of the virus. Pulse oximetry, a painless skin monitor to detect lower than normal levels of oxygen in the blood. Treatment. Treatment for respiratory syncytial virus or RSV usually includes self-care steps. A doctor may suggest a pain reliever to reduce fever. Nasal saline drops and suctioning or blowing the nose can help reduce stiffness. You may need antibiotics for complications like bacterial pneumonia. Drinking fluids helps keep you hydrated if the infection is severe. A hospital stay may be needed. If you have a weakened immune system, a doctor may prescribe an antiviral medicine. Supportive care. Your doctor may recommend an over-the-counter medication such as acetaminophen, Tylenol, others to reduce fever. Never give aspirin to a child. Use of nasal saline drops and suctioning may help clear a stuffy nose. Your doctor may prescribe antibiotics if there is a bacterial complication such as bacterial pneumonia. Keep your child as comfortable as possible. Offer plenty of fluids and watch for signs of loss of body fluids. Dehydrated, such as dry mouth, little to no urine output, sunken eyes, and extreme fissiness or sleeplessness. Hospital care. If the RSV infection is where a hospital stay may be necessary, treatments at the hospital may include intravenous IV fluids, humidified oxygen, a breathing machine, mechanical ventilation in rare cases, an inhaler, bronchodilator or steroid and not proved to be helpful in treating RSV infections. Self-care. You may not be able to shorten the length of a respiratory syncytial virus infection, but you can try to relieve some signs and symptoms. If your child has RSV, do your best to comfort or distract him or her. Cuddle, read a book or play a quick game. Other tips for relieving symptoms are create moist air to breathe. Keep the room warm but not overheated. If the air is dry, a cool mist humidifier or vaporizer can moisten the air and help ease congestion and coughing. But sure to keep the humidifier clean to prevent the growth of bacteria and molds. Drink fluids. Continue breastfeeding or bottle feeding your infant as you would normally. For older children and adults, keep a steady supply of cool water and the bedside. Offer warm fluids such as soap, which may help loosen thickening secretions. Ice pops may be soothing as well. Try saline nasal drops. Over the counter OTC drops are a safe, effective way to ease congestions. Even for young children, follow your doctor's recommendations and the instructions on the product. Use over-the-counter pain relievers. Over-the-counter OTC pain relievers such as acetaminophen, Tylenol, others may help reduce fever and relieve a sore throat. Ask your doctor for the correct dose for your child's age. Stay away from cigarette smoke. Second-hand smoke can aggravate symptoms. Preparing for your appointment. Unless severe symptoms result in an emergency room visit, you are likely to start by seeing your family doctors or your child's doctors. Here's some information to help you get ready for your appointment and know what to expect from your doctor. What you can do before your appointment: you may want to make a list of any symptoms you noticed and when they started, even if they seem unrelated to an upper respiratory infections. Any symptoms you noticed and when they started, even if they seemed unrelated to an upper respiratory infections. Key medical information such as if your child was born prematurely or if he or she has a heart or lung problems. Details about child care. Considering other locations where your family may have been exposed to respiratory infections. Questions to ask your doctor. List your questions from most important to least important in case time runs out. Questions to ask your doctor may include: what is likely causing these symptoms? Are there other possible causes? What tests might be needed? How long do symptoms usually last? What is the best treatment? Is medication needed if you are prescribing a brand name medication? Is there a generic alternative? What can I do to make my child feel better? Are there any brochures or other printed material that I can take home? What websites do you recommend? To what extent should I isolate my child while infected? Don't hesitate to ask any additional questions you may think of during your appointment. Want to What to expect from your doctor? Your doctor is likely to ask you a number of questions such as: when did you first notice symptoms? Do the symptoms come and go, or are they continuous? How severe are the symptoms? What, if anything, appears to worsen symptoms? Is anyone else in the family ill? What symptoms does he or she have? Your doctor will ask additional questions based on your responses, symptoms, and needs. Preparing and anticipating questions will help you make the most of your time with the doctor. Number one, high demand. The healthcare sector is experiencing a boom, creating a substantial demand for qualified professionals. With an increasing populations and healthcare needs, individuals with a healthcare degree find themselves in a favorable job market, often securing positions with competitive salaries shortly after completing their studies. Number two, diversity of opportunities. A healthcare degree opens the door to a wide range of professions, from physicians, assistants, and pharmacists to exceptional therapists and biomedical engineers. The choices are abundant, each offering a different set of challenges, rewards, and remunerations. Number three, physician assistants. Physician assistants are invaluable members of the healthcare team, providing diagnostic and therapeutic patient care under a physician's supervision. With additional experience and specialization, their salaries can swiftly reach the US $110,000 mark or more, reflecting the significant roles they play in patient care. Nurse anesthetics specializing in anesthesia. Nurse anesthetists are integral during surgical procedures, ensuring patients' comfort and safety. Their specialized skills and the critical nature of their role make them one of the highest earners in the nursing field. Biomedical engineers, innovating at the intersection of medicine and engineering. Biomedical engineers work on developing cutting edge medical devices and technologies. Their contributions to advancing healthcare earn them competitive salaries and a spot among the top earners in the healthcare sectors. Number 6. Health informatics specialists. In the age of technology, managing and analyzing healthcare information has become crucial. Health informatics specialized ensure the efficient use of electronic health records, contributing to improve patients' outcomes and operational efficiency. Number 7. Medical science license, serving as the conduit between medical companies and healthcare providers. MSL play a pivotal role in disseminating product knowledge and scientific research, ensuring optimal use of paramedical products. Advancement opportunities. The healthcare sectors offer extensive opportunities for career advancement. Continuous learning, additional certifications, and specializations can lead to enhanced roles and consequently higher salaries. A commitment to professional development can help healthcare degree holders maximize their earning potential. Number 9. Job stability. Given the constant needs for healthcare services, professions in this sector tend to offer high to stability compared to others. The evergreen demand for healthcare professionals make it a sensible choice for those seeking long-term career security. Number 10. Meaningful work. Beyond the meaningful monetary benefits, working in health brings a sense of fulfillment and purpose. Helping people and making a difference in their lives add a layer of gratification that goes beyond financial rewards. Global opportunities. The demand for healthcare professionals is not limited to one country or region. Those with a healthcare degree can explore job opportunities globally, experiencing different cultures while expanding their professional horizons. A healthcare degree is a gateway to a plethora of rewarding career paths. The diverse opportunities combined with high earning potential and job stability make it a soft after qualification. By delving deeper into the numerous possibilities within the healthcare sector, one can find a fulfilling career that aligns with their passion and skills. The meaningful impact and individuals and skills. the meaningful impact on individuals' lives and the continuous learning opportunities make it an even more appealing choice, sparking interest among those exploring their academic and career options.